Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Hi, everybody. Welcome back to the Turd Nerds. I am so excited for our first episode of season 2.
Woohoo!
We've had a little break. We've done a few things. Dr. Sand happened to have a baby.
I did.
She's very tired.
A little tired.
We are very excited to jump into season 2. Thank you guys for all the love we've been getting. And we're going to actually jump in with one of the most important topics that I think gets missed a lot in conventional medicine and gets overprescribed in functional and alternative medicine.
I would agree.
Yep.
So we're going to dive in. Dr. Kapadia has done a deep dive. She's had like 3 months off. She has not stopped
3 months
research.
off.
Is that right?
I mean, I haven't had 3 months off, but
I had 3
I
months
guess
off.
from the podcast.
Yeah.
Anyway,
Who had the baby here?
Yeah.
that's true.
It's been crazy. She just is always, she's had her nose on the internet nonstop talking about food allergies.
What is it? Tell us.
Tell us everything.
Okay, so we're going to start with, as Dr. Gurvich said, food sensitivities in kids and constipation. So I think first it would just be good to talk about sort of conventional approaches and what both of you think about if you're seeing, you know, a child, let's say they're 2, 3, 4, 5 years old and they're having chronic constipation.
I would like to immediately withdraw myself from this conversation because I don't believe in treating people under the age of 15.
But you have kids.
I do look at my kids, and sometimes I look at Rebecca Sand's kid.
All right, so just pretend that you were seeing kids regularly or that it was your kid and you are a doctor. So what are things that you two would think about if you had, let's say we've ruled out all the really bad stuff, they don't have any kind of obstruction, it's not a congenital defect.
Yeah. I'll have follow-up questions to that. Like when we need to do colonoscopies or things like that for kids. Is this sort of after all of that?
Let's assume the kid is generally healthy.
Okay, so no blood, nothing
No blood,
scary
no
coming out of
fevers, they're
them.
growing fine.
Okay.
And let's increase the age a little bit because then we're out of the range of more,
Failures to thrive.
like difficult types of things that of
Yeah.
course would have a regular workup. Let's say the kid's like 5, 6, 7 years old. Okay. They've been
Plus.
fine. Yeah. Or older. They've been fine. And as far as growth and sort of general nutritional intake and all of that, but they have chronic constipation. So I guess the first thing, I'm sure we've talked about this, but you know, what is chronic constipation? It's different for different doctors and different patients. So what do you two think about when you have someone that says, I'm constipated, whether it's, let's pretend you see kids,
Okay.
Dr. Gurvich, but.
Okay, so I'm going to say, generally, if I see a kid and I'm going to immediately assume they have a dairy intolerance.
Okay.
Interesting.
That's where I land.
But where are you defining chronic constipation? Like,
Oh.
are you
That's
just
a
going
good
with the
question.
patient's,
Oh.
the mom's description?
Yes.
What are you, okay.
I go more, well, if I can ask the person in front of me, whether it's adult or a kid, I ask
Right.
them, are they having discomfort with bowel movements? Do they feel like they're getting everything out? Of course, I'll ask how frequently, but I think there's a good range of normal in
Right.
frequency.
I also think, based on what I know as far as a diagnosis in Western medicine, there's a little bit too much leniency
Yes,
to
I
allow
think
people
so.
to be constipated.
Right.
Yeah.
So,
So, like,
like,
are they straining? Is it difficult to get out?
I think those are really good questions. And I think we don't necessarily think it's a great idea to only go by the strict definition of like you're having a couple bowel movements a week. We don't love that.
I don't think that's healthy.
Right. And I know, like I mentioned to both of you, that I've incorporated some Ayurvedic medicine over the years just from my relatives learning, but I'm doing a whole course on Ayurveda, and they definitely, they focus a lot on elimination and GI health. And so I think in general, through more historical practices as well as what we all believe, we want people to be having a bowel movement most days, right?
I would agree.
Okay, so
Is that true for kids though?
I would think kids even more importantly than adults. Because I will tell you, in my experience, not treating kids, but more having kids' friends.
Yeah.
I had this set of friends. I had this friends who had kids, and their personalities would be so explosive and uncomfortable until they started pooping.
Wow. Yeah, it makes so much sense.
It makes so much sense. And then all of a sudden, it was like a different kid.
I guess I have seen kids as patients and have known a lot of kids who are constipated. Right. And I feel like there's so much that plays into it, like fear of bathrooms at schools, home life.
Right. There can be behavioral, like it's uncomfortable to go to the bathroom in public places. There's all of those things.
Yeah.
But
that is also one thing that the child controls, is their ability to defecate.
Right. And so there might be like a more physiologic reason. There might be what we're going to talk about today, but there certainly could be behavioral and other issues that are playing a role. It may be minimally affecting them. It might be a lot affecting them and their, personalities and how they feel in general. So it is a little bit trickier with kids, but generally when I've seen kids with constipation, it's because the mom is bringing them in. They usually do have some sort of behavioral or other sort of issue too. They're usually not just coming in for constipation.
Anxious kids.
Yeah.
Is that what you see?
It usually the mom will report like some particular kid or two. I'm thinking about like anxiety, mental health changes, and or like allergic type issues. And so the mom's started to investigate this whole, could be the dad too. It's been mostly the mom and the kids I've seen. And so basically I think we can agree there's like a wide variation of definition, but in our world, we generally want the kid to be pooping most days. They usually will feel better, behavior will be better, etc. And there can be like these more difficult to tease out behavioral pieces of the puzzle. But we want to try to correct anything we can, which is kind of like some of the stuff we're going to talk about today with potential food sensitivities and constipation. So Alana mentioned she thinks your go-to would be...
So I'm just going to tell you guys a story. I remember I was working with this massage therapist who's also a Chinese medicine practitioner. And, they do like a very quick, Chinese English intake. And I told him I was struggling with constipation. And he was like, don't eat dairy. Stop the dairy.
Right.
That was the only thing. He didn't tell me herb. That was all he told me was don't eat dairy. And then he like jammed his hands into my stomach. It did not help me poop. But so that's why I immediately jumped to constipation. I mean, to dairy.
It's super common. We'll talk about, Dr. Sand, do you have other, like when you think, I forget what question exactly we're acting with. I think I was mostly wondering what your general thoughts are. Like, let's say you are seeing a kid with constipation. You've talked about, school and home life and all of the things. Are there other things that you think about right away?
Yeah, eating disorders on the rise. So relationship with food, how regularly are they getting food? Are they getting fiber at all in their diet? Whether it's not enough fiber, too much junk food, or I've seen kids overload on fiber because they think it's healthy, and it is to some degree.
Right.
Celiac disease, I think we can't overemphasize that enough. I've seen it, I've diagnosed it a couple times in kids alone.
Which can be diarrhea or constipation.
Yep. And then tension, just abdominal tension. So as I've talked about before, I do my abdominal therapy, visceral manipulation. The bellies of kids that I've felt, they're really, really tight when they're constipated. And it's not just bowels I'm feeling, like stool. It's guarding. Like
and it would be like chronic stress response kind of thing with... Of course, you can't, like, if you're being chased by the tiger, you're either going to have diarrhea and then go, or you're just going to be constipated, so.
And also, that fiber thing, like a standard American kid eating a standard American diet is not standardly getting any fiber.
Right.
That's huge.
How are you going to poop?
Yeah.
Right. And typically, again, some of the more recent things I'm just reviewing with the Ayurvedic course is, you have to give yourself some time in the morning, and people are often rushing out the door.
Exactly.
And
especially
that's when
kids, teens.
Right. And that's when we typically would have the reflex to have a bowel movement, which is why we give some of the things we give at nighttime. So if they're just not having time, and then it's uncomfortable to go at school, all of the things. So we talked about nutritional things, physiologic things, stress response, eating disorders, celiac disease. So let's talk about, I found a very interesting study on the role of food sensitivity in kids with constipation. And basically what they showed, they studied about 70 kids, and the kids were between 9 months and 12 years. Guess how many of the 70 kids, so they put them on a 2-week cow milk elimination.
Oh.
Guess how many of the 70 kids had complete resolution of constipation in 2 weeks with removal of cow milk?
I guess 40%.
It's pretty close? Do you have a guess,
42%.
Dr. Sand? So
40 and a half.
it's 31 patients of the 70,
Wow.
just
Wow.
from removal of cow dairy.
Do you know the demographic of these?
9 months to 12 years.
That's
Like
the age group.
patient population.
I don't have offhand, but we can give the reference.
that'd be
Also,
interesting.
way to go, my Chinese massage therapist.
Yeah.
He nailed it.
I know. I mean,
awesome.
it's the first thing I typically do think about, but I think in our older patients, there's often a lot of overlay of other things. So it was great to see. Obviously, this is one study, but almost 50% of the kids had complete resolution of constipation with removing cow milk. So just like make sure everyone think about it, right? Like if you have a kid with constipation, this would be,
Give it a
I know
try.
it's a pain to make kids not eat certain things, but for 2 weeks,
So
you know,
my oldest daughter can't have dairy, and she has formed an entire friend group around
kids
kids
that don't
in
eat
her
dairy.
class that don't eat dairy. That's like their best friends
Oh,
because they have
good.
this thing in common.
That's also so Portland.
Yeah, it's also so Portland. It's true.
I wonder about like fermented like kefir.
it's
yogurt.
all cow dairy, Dr. Sand. So the patients will
trying
say,
to find an
what
out
about
here."
butter? What about this? And I will say, and so this is tricky because I have noticed like over the last 15 to 20 years, I have to be more and more careful with my language, which I should be.
Yeah.
To be mindful of everyone's history with food, right? So if it's we just have obviously it's often easier with kids because the mom is, especially if they're at home still in preschool or whatever, it's much easier than doing it when they're like in middle school or high school.
Yeah, they're
and
not-
it's harder with adults too. So
So if it's all cow dairy, right? That means a lactate pill should make it easier.
it does not. So it's not a lactose deficiency. It also they removed. I would have to look back. I don't think they allowed other forms of dairy as part of, I don't think they allowed, patients will often ask, can I have goat or this or that or sheep or camel? And we ideally just want to remove all dairy for 2 weeks.
Camel.
Yes,
It's
camel
a new
milk
thing.
is
I've
also
heard
available.
of it. Haven't had it.
So
but-
if you're going to do it, it's worth just removing all dairy for 2 weeks. And not everyone is sensitive, so this was, again, almost half the kids. So that means half the kids that wasn't the main and only problem, which we'll talk about some other things with a handful of the kids.
do we have any idea how this compares to adults?
I suspect it's probably similar.
I
at least
suspect adults are more complex. I suspect that dairy intolerances play a part,
Yeah.
but because they're more toxic and they're older, it's probably not the only part.
And they're willing to look past it because cheese is delicious.
Right.
I'm just gonna say it.
and it's hard to avoid. And I think we also have a biased patient population, so that would be very interesting to if someone has done a study on chronic constipation in adults and how many of them can fully reverse to normal if we remove
Totally.
dairy, which
Sorry, go ahead.
oh yeah, no, I do find it challenging. Like I typically will present this option to patients, but yeah, I try not to force it because there's some people that it just causes a lot of
And
problems.
culturally.
Yeah,
So
they're from
my-
Wisconsin or they're from somewhere where like
My family.
yeah, like there's somewhere where it's really hard to remove dairy, and I
Yep.
totally get it. So it may
And
not
food
be
security
worth
issues. Like,
Yeah.
that's a real thing. I'm wondering, so if we're going to recommend this to our patients, and kids,
particularly we're talking about kids.
Yep.
If you want
Yeah.
to do a 2-week trial off of dairy.
so that's what we'd recommend is say you should see benefit in 2 weeks.
Yep.
And it's not necessarily, it gets, worse when you reintroduce it. You should actually feel better within that 2 weeks.
So let's talk about, you should, and I also want to go over a couple sort of concomitant symptoms in the patients that had the cow milk intolerance. But first I want to go over, so of the patients that did not resolve their constipation on the cow milk free diet, they found about 7 of them did improve if they did a more what they called oligo-antigenic diet. So they did an even more comprehensive elimination diet.
Eliminating what?
There was several other foods. Most of the kids who responded, they removed wheat, egg, tomato, fish, chocolate, soy, and they weren't allergic to all of them. This is not the standard elimination diet I use, but it does include, wheat, egg, dairy, which are the 3 most common food sensitivities I think we see in people. Soy is also pretty common. So of that group, they had some combination of some of these other intolerances, not all of them. So it would be rare, although it's possible to react to.
So wheat, dairy, soy, egg, fish, tomato,
Chocolate.
But I don't use that.
Yeah.
That is what they use.
What elimination diet do you use?
So gluten, dairy, soy, corn, egg, yeast is the typical go-to one that I've learned over the years from some of the old time.
And you're not differentiating between organic and GMO.
So I have a handout that I should try to post when we post this, where in the top part it goes over like, first, let's just start here, right? Like let's do organic if we can, or at least do non-GMO, because there's a lot of crops that are not GMO. So there's crops like legumes and grains that even if they're not GMO crops, they can be heavily sprayed.
Yeah, for sure.
So I have kind of a list of those foods where like, okay, let's start here and just clean up your diet, and that might be enough. But again, with our patient population, if they're already eating relatively well and organic, etc., and they're still having a lot of gut symptoms, then we move to like a more elimination challenge diet if they want. If they want to explore that tool.
In kids, you do this?
In kids, I typically don't do a full on, but in kids, it's mostly been moms bringing the kid in and saying, I noticed improvement when I removed these things. What do you think? Is this real? Is there other things we can do to help? Because there's still some symptoms. I'd rather just keep them off these 1 or 2 foods that are bothering them, but what else can we do? So I haven't initiated it in kids very much. Occasionally I have if the family hasn't done it yet, but usually they've already done it, and then they're coming for sort of other treatments.
And then how long do you have people stay off the food?
That's tricky. I mean, there are therapies. So there's a couple. We need to talk about some more stuff, but we know like kids, like younger kids, like babies, have elevated intestinal permeability.
Yep.
So some food sensitivities will resolve on their own as their gut seals up to whatever is normal these days. But I think some food sensitivities, some people just have.
So I did I put together a study looking at pancreatic insufficiency, which we'll do, I think we've already done. And then I looked at I wrote a different presentation looking at like all of the vegetarian enzymes and how they work. And one of the things that I discovered is, congenital lactase deficiency. Mm-hmm. So oftentimes children will naturally make lactase up until somewhere from age 2 to adulthood. There's like half of the population that continues to make lactase and half of percent of the population that discontinues it at some part of the aging process as early as 2.
Yeah.
And I wonder, literally it is at least half of the population.
Right.
It makes me wonder if this is what they're talking about.
Well, I think there's a lot of confusion over like lactose intolerance versus a dairy intolerance, right? A casein intolerance. So that should be relatively easy to tease out. If you give someone lactose-free milk and they don't have a problem, and then they drink regular milk and they do, sure, lactose intolerance. But at least in the people I see, it's much more common for them to have dairy intolerance if that's the problem. And typically with lactose intolerance, we're seeing more diarrhea. With this dairy intolerance, it is sort of like I think you would call it like a keynote. I've learned from you guys in homeopathy, but in a regular sort of like practice of what we do, it's typically constipation with cow milk intolerance or dairy intolerance. So
that is really interesting.
Okay, so that's the dairy piece. So the sort of summary so far would be, if you have children with constipation, be mindful of all the other factors, but if the family and the child want to try an elimination of a relatively short period, you could try removing cow milk, dairy, and all dairy for 2 weeks. If that doesn't work and they're super interested in pursuing, it could be helpful to do a more comprehensive elimination challenge for a few weeks, just to identify if foods are playing a role, and then you can figure out what's our long-term plan here. Like, we always want to minimize what someone has to avoid, because it makes life very hard. So
Totally. And
we can talk more about that.
You're not getting success just having them take enzymes, because I feel like the parent's next question would be, well, can I have my kid just take enzymes?
There is no enzyme that works well enough for casein.
Right. I don't think there is, but I do think there's a way to desensitize it with some of the sort of complementary medicine ways of getting at things. It's not standard of care. We can kind of talk a little bit about it. If someone does have a lot of different sensitivities, it doesn't mean it has to be forever, but for the first step is identifying it. So,
and I do think 2 weeks is not a huge ask.
Right. It's just, I like to be mindful, because I think I assume, we sometimes assume other people's life is like our life, and it can be challenging for some people. Okay. The other part I wanted to talk about was findings on endoscopy and rectal biopsy in the same study that I just talked about. Do you have any guesses on
This is my favorite game.
Okay. Do you have any guesses on endoscopy? Think about other conditions, what we look for on upper endoscopy. what they might have been checking for and what might have been abnormal with the kids who had the food sensitivities. Any guesses? That's kind of a vague question I'm asking.
Gastritis. They found gastritis.
It's a good guess.
Okay, I'm going to say eosinophilic esophagitis. Ooh, did I win?
Okay, so they found a significantly higher number of eosinophils and lymphocytes compared to the kids who had constipation not associated with food intolerance.
Should have known.
But it was a good.
It was the topic
that was a
of
good
the
guess.
podcast.
Okay, this is also very interesting. Those with food intolerance had reduced thickness of the mucin layer in the GI tract.
Sense.
That normalized on the elimination diet.
Wow, great.
So wait, can we just chunk that out? I think that's
Yeah.
a really important. So basically, when we're talking about the mucin level, what we're talking about is the layer of basically mucus that separates the enterocytes or colonocytes, depending on if it was endoscopy or colonoscopy, and the microbiome in there, right?
Okay.
And that, so basically, I always think about, like, there's the ground, which is the enterocytes or colonocytes. There's the mucin, which is the foundation of the house, and then there is the microbiome, which is like the floor, right? The thicker that mucin, and the small bowel has one layer, the large bowel has two layers. The thicker that mucin layer is, the more protective it is against the microbiome, which is not you attacking you.
Right.
And so that what's going to happen if the microbiome is attached to your enterocytes directly is it will irritate them, causing more eosinophils and gastroenteritis or gastritis and all that. So that's what we're talking about. And so when we have people eating a lot of food allergens, the bacteria that is there is either eating up the mucin too quickly, which is a normal way that they get food, or you're not able to produce more mucin from the cells.
Great explanation. The other sort of pearl I learned from one of my mentors many years ago, and why we kind of like try to get a sense of what food sensitivity someone might have, is that if there is this chronic sort of irritation from food allergens, you're just kind of a setup, like Dr. Gerber said, for recurrent infection. There's just more going on with the immune system. You're less able to fight things off.
You're asking more of the immune system,
right,
and therefore unable to fight things off.
And that's in the gut and the sinuses and wherever else the issue is taking place. So, okay.
That was interesting.
Speaking of chronic, people with chronic sinus congestion as well, I find dairy to often be related. So
for sure,
I agree.
Yep.
Similar but different issue here. Now, the other finding they discussed was rectal biopsies. And they found that patients with food intolerance and chronic constipation showed inflammation and mucosal erosions that cleared upon removal of the food.
So kind of exactly what they found upper.
Right.
This was specific to dairy still, or food?
Dairy, and there was 7 kids who had other food sensitivities.
Wow.
Yeah. So it cleared on removal, which is great that it can sort of be reversed.
Yeah. And this was only a 2-week removal.
This was a 2-week removal. I don't know when they did the follow-up studies, if they had, I don't know if they had them stay off of it longer before they repeated the endoscopy rectal biopsy.
That's interesting.
Okay, and then testing. So some people might wonder, like, is there a way we could just test for this? Do I have to do removal, right? And so they talked about how IgE testing was often negative, so we definitely can't use that. And IgG testing was positive more, but still missed frequently. So really the gold standard is elimination challenge.
I think that's always true with these kind of...
it is.
Yeah.
And then here's another question. How quickly do you think constipation reappeared when they did the challenge part and added cow milk back?
I want to say 2 weeks.
For the first recurrence of constipation?
When the constipation return was 2 weeks later.
Okay. Dr. Sand?
I'll say 5 days.
2 days.
2 days?
2 days.
Whoa.
So they theorized that it was a cell-mediated hypersensitivity based on the time frame of when symptoms returned after reintroduction.
That is kind of interesting.
So you should have an answer relatively quickly. The confounding factor is, do they have other food sensitivities that are also playing a role, or other gut bugs? But reassuring that in kids, at least almost half the time, you got some sort of answer. If you don't get that clear of a response, then you have to think about, am I missing some other foods? Is there what else is going on here? Right. And unfortunately, then you can't rule in or out completely a cow milk intolerance if you don't get resolution with the 2-week removal and then recurrence of symptoms a couple of days later.
So, okay, here's my big question. This is probably a tangent. Intestinal permeability issues. So let's just say someone has intestinal permeability due to SIBO or SIFO or something else.
Right.
they may present as somebody with food sensitivities.
Right.
Like, it's kind of a chicken or the egg thing, but in what cases do you just say, hey, if we fix your gut and some underlying cause, you may be able to eat these foods again?
So I remember going to an environmental medicine conference, and one of the senior doctors said, you don't grow out of food allergies, you grow out of your pants. So his theory was, and what, you know, he had been practicing for like 60 years. I think it can present...
that quote makes him sound like he's been practicing for 60 years.
Yes, but he seemed very smart also. I think there's a chance it can be reintroduced. I think often people think they're doing fine on it, and then they come in with some, like, I keep getting URIs this year. I don't know why. I keep getting sinus infections. And so it can change, the symptom pattern can change, and maybe it's not causing, what I've seen is like maybe it's not causing that initial symptom anymore. It's doing something else. I wouldn't rule out that someone can get over it with certain specific interventions that we can talk about, or by healing other gut infections. Certainly there's hope for improvement, but I also think there's a subset of the population, probably for genetic and other reasons, that it's a root cause. It's not an effect.
I also will say that I do think there is probably a gradient.
Right.
You know what I mean? Like,
right.
I am very, very intolerant to gluten.
Right.
I used to go home, eat one slice of the best pizza on earth, Vincent's Pizzeria, at my parents' house, and I would have really, really bad symptoms for 3 days.
Right.
And one year I had 3 slices of pizza, and I had symptoms for 3.5 months.
Okay.
And after that, one slice was not worth it. Like, I do
But
think
you
there's
can
a
eat
gradient.
that bread that has gluten.
But I can eat, it's like, you know, processed.
Right.
You know,
So-
and I'm not celiac.
So that's a gradient.
Yeah,
right,
I think
for
that
you.
there is a lot of gradients, and I think it's like, I think it's up to people to discover their gradients.
Definitely.
I also think people who have like a huge chunk of my patient population, people with SIBO, like an infection, something up with the microbiome that we need to kind of address.
Right.
And they come in having done elimination diets of some variety of their own and saying, I can't eat beans, I can't eat lentils.
Those
can't
I
eat
think you
greens,
can get back
eat...
usually.
Exactly. Yeah. So I think we want to differentiate between things that are common allergens, like you listed off, and people who have self-labeled food sensitivities or maybe other providers.
I agree. Because we want to limit the number of things that we keep out, which is why I don't love the low FODMAP diet. I think it can be useful short term.
Really don't.
Bad for the microbiome.
Right. Like, I don't like to remove healthy foods. Another quote from one of our mentors, like, we ideally don't want to put someone on an unhealthy diet in a quest to like regain their health. So in general, I do think cow milk causes problems for a lot of people, unfortunately. That being said, some of my patients can do goat or sheep and feel fine. Others can eat the cow dairy once in a while, and it's a pretty mild reaction. So like Alana said, like, then you just know, okay, I might not feel great tomorrow, but I'm making a decision. At least you can make like a conscious decision, you know?
I also wonder, have you guys been following this A2 cow thing? Do you guys know about this?
I have patients that tell me they think they can tolerate like A2 milk and not.
Yeah. Basically, A2 is how, like, this breed of cow in Europe.
Yeah.
And so that's why they think cow milk in Europe is easier to be absorbed, because there's something magical about this animal.
Right.
Where the milk is not as...
full of antibiotics?
Well, no, because it's not America. Mm-hmm. Yeah. We're number one at antibiotic
Yeah, America.
So let me kind of summarize anything else from this study here. Okay. So kind of long-term management strategies. So then what do you do if you find that the child is cow milk intolerant? So if you're in Portland, you can form a group of friends who are all intolerant of dairy. If you live in Wisconsin, that might be harder.
Yeah.
But that might be possible still. I mean, the number of products these days, even when
crazy.
you go out to eat, I'm sure it's not like that in like Ohio. My friend is from Ohio. She said I can. I'm sure there's certain cities.
This is what I'm going to say about dairy-free, gluten-free, any of these free products, is if
They're
you
still
drop
junk,
dairy
but
and then you pick up dairy-free cheese or dairy-free milk,
That's
it is
kinda
not going to be good.
Yeah.
But if you drop
Right.
dairy and you give it some space where you forget dairy,
Right.
and then you introduce dairy-free, it is magically delicious.
Right.
Only to you.
That's true. I think if you are used to eating regular
and
cheese.
I will say they do, in my experience in my household, definitely there is different different fake cheeses or dairy-free cheeses do different things. So you need to know what you're doing.
Yeah.
If you experiment long enough, you can make some pretty good things. Like, I have a friend that would always make the most amazing, like, spinach artichoke dip with dairy-free cheese for me.
I know. There's some really good stuff.
Yeah, there's some good stuff.
Conventional stuff, I'm pretty sure, is indigestible. I think it just
I
sits in
mean,
your
it
stomach.
is a bunch of gums.
I did fine on it, but
yeah, I don't do fine on it. It's like a bomb.
I don't think anybody does fine.
Once in a while, I think it's okay. But anyway, back to what do you do? So I think cow dairy avoidance, while it can be challenging, is doable. It can be more challenging if your kids are in, or your patient's child is in like a school where you don't have a lot of control over things. There are some therapies you could seek out. Practitioner who does what's called low-dose allergen immunotherapy, and you can look up, you can Google that and find the practitioners who do that. It works for some people. I don't think it works for everyone, but this is just to give you some ideas. If you're kind of stuck and avoidance isn't an option, I find more challenging when particularly a child has multiple food sensitivities, right? So because we don't want to make it super hard for them to socialize and hang out with their friends and such. So that would be another reason to consider seeking out one of these other practitioners who has done one of those therapies for a long time. Of course, we can also use mast cell stabilizing medications in kids, depending on their age, et cetera, like ketotifen, cromolyn, et cetera.
Do you think that would help the constipation?
So I don't think it would resolve it. I've had patients where if they're on those, they seem to react less if they've had so we're not talking about IgE serious reactions. We're talking about like constipation, I don't feel good type of reactions with food sensitivities. I've had patients where they don't react as significantly. I don't think it would like stop the constipation. But for example, I have a patient with eosinophilic esophagitis, and dairy and several other foods were triggers, but if he's on the cromolyn, his reaction is 50 to 75% less.
It's not bad.
That's pretty damn good.
I don't have studies for in kids and cow milk particularly.
Do you have dosing for kids for those medications?
I'd have to look it up.
Somewhere out there.
Yeah, it's somewhere out there. I know with kids with autism, ketotifen has been used quite frequently.
Yeah.
But I'd have to look up exact dosing.
And you bring that up because autistic kids generally are not tolerant of dairy.
So they can have food sensitivities. And so when I initially learned about using ketotifen, it was in children with sort of neurodevelopmental issues that were often allergic as well. And there had been some of our mentors had put out like, okay, try this protocol with ketotifen before meals, etc. At this point, I just use ketotifen once or twice a day. I've been told that you don't have to give it before meals and such.
Is there any role for natural products?
I'm sure there is. And, I think I can't remember if we've done MCAS talks yet, but in general, I think most of us are agreeing that we are seeing more definitive results with medications. Sure. And so what I'm telling patients now is at least we try the medications if they're open to it. And then down the line, we can try the nutraceutical options. But I think particularly with kids, it would be hard to sort out because it's already hard to sort out. Although with constipation, I have not specifically used a lot of nutraceutical mast cell interventions with kids.
Yeah.
Okay, so that concludes our episode.
Okay, so let me recap.
Wait.
Okay.
Just one more thing.
Yeah.
I think if you're going to remove dairy from a kid's diet, worth considering providing a list of foods that also contain calcium, protein, and fat for the kiddos, so the parents aren't left empty-handed.
Great idea. So greens and nuts and, of course, things that kids love.
Nut butters, yeah.
Kale.
Kid food.
I'm sure I'm going to say
your kids do.
My kids love
your kids,
especially my son.
Yeah,
he loves kale.
Right. So there are lists.
We were in Portland.
We were at the grocery store. I think we were in Bend at the grocery store, and he's coming with me shopping, and he's like, "Mommy, can we get the kale?" And everybody's looking at him and like whispering, like,
"Yeah,
who's the weird kid?"
The child was bribed.
Okay. Can I recap what I just learned?
Yep.
Our famous recaps. That I'm saying famous, and now they are. I learned that 35 out of a study with 70 kids
31
aged 9 months to 12, 31 of them responded to elimination of dairy and all dairy products for 2 weeks. That constipation returned at the 2-day mark. So it's a pretty clear, you do it, you pull it back, you put it back in, and you have a yes or a no. There are also other intolerances that could go with it. 7 kids out of these 70s had multiple intolerances. Right. They did interesting ones like fish, like tomatoes, like gluten, like soy, like eggs. You do more egg, soy, corn, dairy, yeast.
I can only say it in one order.
Okay,
gluten, dairy, corn, soy, egg, yeast.
Gluten, dairy, corn, soy, egg, yeast. Okay. I don't even know. What does yeast mean? Like no cakes?
Nutritional yeast and yeast in breads.
It's
high histamine, and it seems to be a food antigen, particularly, again, in people who might have mold issues and or yeast imbalance in the gut.
Yeah.
Or it's a histamine. It's a histamine related
and
issue.
Beer. Don't give your kids beer.
Right.
Okay. Really?
Yeah.
But maybe let them try it before
You're
college.
You're going to have to cut it out.
Yeah. Okay. Did I get the hind loads? Did I miss anything?
I want to add in the testing for this. Food allergy testing, IgG, still not a great option. We want to do food eliminations. Tailor it maybe to your population, depending. But that I think is worth saying again.
This is awesome. That was great information.
Okay, last caveat. I will say I do find dairy frequently on IgG food panels that I run. So that's more in adults. I wonder if in kids they haven't gotten as much exposure and so they haven't generated the antibodies yet. In adults, I do find dairy show up frequently.
Okay.
So that's it.
That is a great episode.
Woo,
thanks, Emmy.
Awesome.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.